We're going to talk about septic arthritis first because this is considered one of the few rheumatic emergencies. Again, this is considered a surgical emergency or urgency when a patient does present with a septic arthritis. A patient will present with an infected joint that'll be usually caused by a bacteria, can be caused by other organizations, most commonly a bacteria. And oftentimes it's a hematogenous spread, meaning they have an infection somewhere and it's spread to the joint. But sometimes it can be a result of a direct trauma or an iatrogenic result. For example, in a location where a patient has had an injection or previous surgery. How does the patient present? The joint is warm, inflamed, painful. Multiple joints can be affected, but when they are, start thinking about a source that's causing sepsis, such as endocarditis and shedding some infection through the body. Key at-risk groups to keep in mind: staph and strep are common for patients who have septic arthritis and are healthy otherwise. Neisseria, gonorrhoeae, again, for sexually active patients. Salmonella is something to keep in mind for a patient with history of sickle cell anemia. Kingella, kingae for children that are less than 2 years old. And patients who are immunocompromised for various reasons can have all different kinds of microorganisms leading to septic arthritis. Ultimately, the take-home point here is that it's important to follow cultures and reevaluate for potential improvement or lack of improvement to initial treatment. And if the patient's not responding, to start looking back to see if there's another or alternate etiology.